Hi, I'm Steve.
And I'm Sue.
And we're aging joyfully.
So this is part 2 of our insurance after losing a job. Part 1, we talked about Steve getting on Medicare and why we chose Medicare. And today we're going to talk about what I got on for insurance because I am not old enough for Medicare. Once Steve lost his job abruptly with no warning, we lost coverage that day.
Exactly. And so when you lose a job, you do have an option to take what's called Cobra, which is insurance that covers you for 18 months, typically, and there's an additional cost. If you're the spouse of a person who had insurance, company insurance, then you can get on Cobra. The person...
If you were insured while that person was working. If you're not on their insurance, you're not eligible for Cobra.
Right. They would have had to have been on that insurance while you were working. Now, you're also entitled to Cobra. And Cobra usually lasts about 18 months, but there's some stipulations that it can last longer. And it's a greater cost than what you were paying from the company that you worked with.
Well, one of the benefits of that job was the company paid part of your insurance while you paid part, even though it felt like you were paying a big chunk. You're surprised when you see what the real cost of insurance is. Plus, they charge, I think, about 2% above that cost. So Cobra for me alone is $600 a month just for medical.
Exactly. And so what we selected on Cobra was for Sue to have medical and also dental, and dental for me too. So I can get dental just like I had dental before through the same company, and you pay an extra for that. $45 for both of us per month.
Now we're only keeping dental probably till the end of the year. That's not affordable for us. Luckily we had most of our dental work done in the last year because I saw this coming. I've been reading lots of books on retiring, and they say how you may be forced into retiring before you want to. We did not want to, but they said typically if you get sick or whatever reason that so I said, you know what, we should get our dental work done now while you're still working, because I knew one day we're not going to have dental insurance. So we just got a lot of dental work done, thankfully. So we're going to get our teeth cleaned in the fall, and then actually you could drop it month by month. So we may drop it right after getting our teeth cleaned.
Yes, absolutely. So you really have to think about your money, and you have to plan, and you have to make decisions and budget. And of course, all of that comes along with it. But the health insurance that Sue is getting is the same health insurance she had before. It just continues. You use the same card. You use all the same stuff. You have the same deductible. You're paying the same copay for going to a doctor. You pay the same for a specialist. So it's really nice, and it gives you some breathing room for the next 18 months. Now, there are some situations that can continue for
36 months. And again, we're not experts in this. We were shocked when we got the paperwork in the mail. It took about 2 weeks. It said that if I had gotten divorced or Steve died, or I believe the third case is if you're a child who turns 26 on your parents' insurance, you could get it for 36 months. Right. I was shocked. I thought Cobra was always 18 months.
Right, exactly. And so the cost for Cobra is about $600 for medical.
For us. It's different for everybody.
Right.
My sister paid $900 when she was on Cobra, so she's like, oh, you're on Cobra, so you're paying $900? I'm like, no, every company's different, and our deductible is so high. I believe that's why it's more affordable, because we didn't have a lot of choices in Steve's job. We did not purposely choose a high deductible. We only had a choice of maybe 2 policies, and I think both of the deductibles were pretty high. So we looked at that, and then we also looked when we got Steve on the Medicare supplement. That insurance agent looked up ACA for us, Affordable Care Act, which in Georgia is technically gone. Georgia's the first state that changed to a different insurance. Do you remember the name of it?
No, I don't.
I don't either, because this is the first year and it never applied to us. But if you go under ACA for Georgia, it kicks you into the Georgia Oh, there's a car that just went by. Kicks you into the Georgia website, and she gave us a quote of $900 with a huge deductible, and I was like, $900, and the deductible I think was $9,000, which was even more than our really high deductible.
Yeah.
And I was like, well, there's no thought there. It's based on your income, and we have been pulling money out of retirement. Basically, Steve was working for health insurance for me. The job didn't pay, in my opinion, really what it should have been paying. And we have been living on our retirement for probably 6 years. We've been putting money into retirement through his job, so it was matched, and we got the tax deduction, but then we've been pulling money out to live on. So his check literally would be $50 every 2 weeks, so he brought home $100 a month. That was after the 401k, which we maxed out every year, which is only a maximum, it's only $30,000. So if you're making $30,000, you're over 62 in Georgia, you should be putting that full $30,000 in and pulling it out, because you save this Georgia state tax. You get at 62, you get a $35,000 exemption. At 65, you get a $65,000 exemption. So we were running all of his check through 401k plus all his other deductibles. There's so many deductibles. There was disability insurance, life insurance. I don't know. There was a lot of deductions. So there wasn't much left in the check. Now, towards the end of the year, as we got closer to that maximum 401k, the check might be a little bit bigger for a couple of months. But we already have been budgeting our money, just like somebody who's self-employed or somebody who's a realtor or whatever. We have been pulling it out of our 401k and living on it. So we had X amount of dollars per month to live on. So we've always been very, very frugal. So cutting back, that's not the issue for us. It's health insurance, which is the wild card.
Right, exactly. You never know what it's going to cost you for your health. And that, it just seems kind of silly, but that's the way it is in the United States. And so we really have to plan, and you have to make sure that, God forbid you get sick, that you're going to be able to cover it and not have to claim bankruptcy because of an illness.
But although he'd been working for health insurance, now that we're paying this huge amount 2.5 years early,
right?
Now we do need to replace that income that we've lost, because that was not factored in addition to everything going up. Right. So of course we do need income on top of the health insurance. It's a scary, scary time, because we don't know what to do. Nobody knows what to do. Like, we go out to a store or somewhere, and everybody's just so sad.
Yeah, everybody's so sad and quiet, and it's not, and none of the "how are you" or "good morning" or And I always tend to say "good morning" or "good afternoon," because really, I'm not going to let people's attitudes really get to me, but it does. It does get to you. And so it just seems like a very, very sad time.
And a lot of people think, oh, it doesn't affect me. There's a lot of people who are retired with pensions, 401ks, money. My sister is comfortable. Even she seems to be a little sad too. So, and I told her, I said, you think that this doesn't impact you because directly, you've got your set, you've got your insurance, you've got your money. But it does affect you, because everybody around you is struggling. Do you want to be the only one? Like when I was working as an auditor after college, I worked with this guy who lived in a small town. He was the valedictorian, and he said, do you want to be the big,
big fish?
The big fish in the little pond.
Right.
He said it's not always fun to be the big fish in the little pond, because you're the one who has all the money, but nobody can go out and play with you. So it's kind of lonely to be that big fish in the little pond. He says it's better to move to a town where everybody's equal, and you've got people on your level where you can have friends who can do things that you do. Like another example is our good friends who own a Chick-fil-A, extremely wealthy. Anybody who owns a Chick-fil-A is top income. And they joined a country club because they moved to a town a little bit away from their Chick-fil-A. They didn't know anyone. So they joined a country club to make friends. And everybody at the country club were in their 70s and 80s. They were retired doctors. And they took us there for dinner, and everybody had white hair, and they were with walkers and canes. And I just thought, they're like, they're younger than us. They're in their 50s. And again, they're the big fish in the small pond.
Right.
So it's just not much fun when you have nobody to play with.
Yeah, exactly. You always want to be either the little fish in the big pond, or you want to be equal. And that you just got to pick your choices. But getting back to Sue's health insurance, I think we're in a good place right now. Except that I am looking for a job, and it doesn't have to pay $1 million a year. We just need to cover the health insurance, the supplemental, the Cobra, and all of that adds up. I mean, when you pay for it every month and you see how much you're paying on it, you get kind of concerned.
Here's the thing. Right now, we're paying $1,100 with the dental and our two insurances. We're paying $1,100 a month. That's pretty costly. We have been paying about $400 a month, taken out of Steve's check. So we never saw it. And taken out of the check, it is tax-free. When you're paying it on your own, it's no longer tax-free. Now, we did have some HSA money, so we can submit it with that. We had saved this HSA money for when we retire. It's almost gone. We thought it didn't even make it. It didn't even make it to retirement. So we could submit that. That is tax-free, which we probably will submit it because, it's cost now. Okay, so in January, I heard insurance is going up. What was it? Some ridiculous amount.
Yeah.
Everywhere is going up. I think HCA is going up, 75%, some crazy amount. So we are going to look at ACA again if we could keep our income low next year. Of course, that's hard to play around with your income because what if Steve did get a job in the middle of the year, which I don't know. I say the odds are slim based on the jobs report and the videos, all the YouTube, TikTok videos I've seen, and just the neighbors. Our neighbor lost his job a year ago. He did find another job. I'm seeing people lose jobs. I don't know. So if he gets a job that could impact the income that you projected, but so you have to be really, really good with projecting your income and keeping it at that. So there's some emergency. Then what do? Then you had to pay huge insurance premiums because you had to pull out more money for this emergency.
Life is tough. Nobody ever said it was going to be easy. With a master's in business, it does help, but there's still these gotchas and these what ifs, and you do have to budget and be prepared. And that's the biggest thing that Sue has taught me over the years is budgeting. And that's something, it's not 100%, but it sure does have you in a good place when you have to be there.
But I don't have a crystal ball to know what's going to happen in the future, or do I?
So this is how Sue's been figuring out what's going to happen and how to budget. It's her crystal ball. Look at that. I can see the future in there.
And don't forget the stand.
Oh yeah, and she's got the little stand that comes with it.
Actually, an old boyfriend gave this to me because he was so impressed at my intuitiveness and insightfulness that I could always say what was going to happen and I was always right.
Right, exactly.
And right now what I see is hard times. I see this being worse than 2008. And I know, if you say that to people, they say, oh, you're negative. I call myself a realist.
That's right.
And before this even started, I said, this is going to be bad.
Yeah.
This is going to be bad.
Yeah. Sue and I have been together for 34 years, and she calls it. I have to admit, she does call a lot of things that do happen, and it amazes me. So, I give her a lot of credit for that she can see the future, and I believe that crystal ball does work.
I can't see the future, but I have a good sense of sixth sense and intuition. Right after our son was born, we moved to another state, and it was July 4th weekend, and I said, you're going to get a ticket right now. Slow down. Did Steve listen?
Of course not.
Did you get a ticket?
Of course I did.
How many minutes passed from when I said it to you getting that ticket?
It was pretty close. It
was about 2 minutes. Yeah. I said, slow down now.
Yeah.
And I didn't see a cop. Did not see a cop. I just sensed it. I just sensed he was going to get a ticket.
Yeah, and that's something simple. I mean, Sue has seen a lot of more difficult things too in her crystal ball.
I don't use the ball.
She says that, but she does.
No, I knew things like when my mom was going to die. She'd been sick for 7 years, and I said she's dying on this day, and she did. She did. So just. I mean, I'm not saying I can tell the future, but I just have this intuition, and yeah, I hope I'm wrong. I hope I'm wrong, but I don't see how I can be. When they started laying off thousands of government workers, I said that will trickle down faster than anything than the Reaganomics that didn't trickle down. But laying off thousands of government workers means they're not going to the daycare, they're not going out to eat, they're not doing this and that. And most people don't even have health insurance when they get laid off.
Right,
Well,
and they've cut down on their grocery shopping, and they've cut down on buying clothes.
when we got the insurance and we got that insurance agent, I asked her, so have you had a lot of calls? She said, no, what do you do? No. And I thought, well, we got her from our friend who her husband had just lost his job, and luckily, very lucky, got another job. And they went without insurance. Well, she was on Medicare. He was not. He went without insurance. And I thought, yeah, you're not getting calls because nobody's getting health insurance. They're eating and paying their mortgage. That's why you're not getting calls. Health
Right.
insurance is not even, it's a luxury. It's a luxury. It's like a vacation.
And I hate to say that, but it is. It is a luxury. And I think it's a luxury that, you know, if you have one illness, I mean, you have to be, if you don't get health insurance, you have to be willing to say, okay, yeah, bill me. And you're not going to pay those bills. And so you have to be, you know, ready for those phone calls and letters and your credit being ruined. And
Well, they're not choosing. They're not choosing
no,
that.
I don't think they're choosing. It's just what they have to do. If you can't get health insurance, then you get sick. You still have to go to the doctor, but now you're not going to pay. And so they're going to continually send you bills and harass you and ruin your credit. And so, I mean, you're in a bad place no matter what.
Well, I believe if you're a lot younger, your insurance is not this high, because one Thanksgiving, I was asking my nieces and nephews what they pay, and at the time we paid like $350 or whatever, and my nephew who married my niece said, "What do you have, Cobra or you're self-insured or something?" I said, "No, that's through the job. That's what we have through the job." And he was shocked because it goes by age, and as you get
Right.
older, so they're paying. I mean, I think our son paid $0 forever because he had a high deductible, but I don't know what, I mean, other people pay $50 and $100. So when they have Cobra, it's not going to be
Right.
the $1,100.
Right. It all depends on your situation. I mean, that's what it comes down to. And that's why you have to set up different scenarios for yourself in your situation.
So, yeah, but I know when Steve, he had been caught in reorganizations when he was younger. And I actually had a friend in Georgia. It seems like people come here. My friend said they come here for just a layover. They have a job for a short time and move on. And her husband lost her job. This was 35 years ago or something. And the Cobra was, I think, about $300 for the whole family of 4. And she's like, who has $300 a month? So they went without insurance because they're like, nobody has $300 a month. And I remember when we lived in New York, it was, I think, $300 a month at that time for maybe a couple, an older couple. And they said the same thing. Who has $300 a month?
Right.
$300 a month was a lot for health insurance. And today, yeah.
Yeah, especially in New York.
So in January, it's going to go up. So we will look at ACA again to see if it's any more affordable. I just know I won't be going to the doctor unless I'm near death. I know, and that's really just sad that a country with this wealth that we have to make these choices and say, yeah. Can't go to the doctor. That's a luxury.
It is sad because you hear stories about other countries, and yes, other countries you do have to wait and they do prioritize you to condition, and it is taken out of your taxes and that kind of stuff. But the bottom line is that you're not having to pay this exorbitant amount every month. When it comes out of your taxes, it's something you really don't see. And so, you know, and then if you're prioritized, if you're on the edge of dying, of course, you're going to step in front of somebody who has a sprained ankle. So, you really have to pick and choose.
It shouldn't have to be this way. It should not have to be this way.
Now, if you look back at history in 1940, after 45, after World War II, Britain chose to provide national health coverage, and America chose to have a payer plan and not provide national health care. I kind of wish we went the other way.
Oh, of course, we wish we went the other way. I'm just saying that our life expectancy is coming down versus other first world countries. Ours is coming down. We don't get what we pay for in many ways.
Yep.
So yeah, we've been disappointed with health insurance for quite a while. But look for part 1. We talked about Medicare, and this is part 2 of Cobra, and it'll continue.
Yeah, and just remember, stay healthy.
But see, that's the thing. We are doing things to stay healthy, and there's been things in the news that certain people think you can control your health. Yes, to an extent, you can control what you eat or exercise, but you can't control what's been put in your body for the years. You can't control the plastics that we all are ingesting,
right,
or the poisons in our food, or the dyes, or the environment, or the toxins in the air that we've been breathing in, or what your grandmother. I saw studies in other countries where what your grandmother was exposed to affects your health. So my grandmother was dirt poor. So I couldn't control my grandmother. I couldn't control my mother.
Yeah. Well, true. That's all very true, but you don't have to contribute to it. That's the whole thing about staying healthy and eating healthy and staying away from processed foods and soft drinks and alcohol. Excuse me, alcohol and cigarettes, and fried foods. I mean, there's so much that you can stay away from, so you're not contributing to whatever health issues or toxins that are in your body right now. And eating healthy, sometimes it's very boring and very bland, but it's kind of what you want to do if you want to stay on this earth a little bit longer.
Well, I've been seeing a lot of videos of people showing them what groceries they're buying, and when they show their cart, a lot of people have orange juice or soft drinks, and I thought those are first things to go. We only drink water, and Steve was drinking flavored water, but I told him that is the first thing to go in our grocery budget, because we're spending about $1,000 a month on food, which is ludicrous, just ludicrous, right?
Yeah, well, the whole thing is that if you're eating fruit and vegetables, which we do eat a lot of fruit and vegetables, you can only buy it for so long, so many days, and it rots. So you want to eat it before it rots. And so then you're buying it over again, and prices have gone up. I mean, avocados, that's pretty healthy for you, and the price could be $10 for 6, or it could be $6 for 6. It all depends on where you get it. But, that's one thing. If you look at spinach, they can be kind of costly. Carrots and cucumbers and celery, and peppers, it all can be very costly. But, if you want to stay healthy and eat healthy, it's going to cost more than that $2 hamburger at McDonald's, or that frozen processed food that's on sale, at the grocery store. That stuff is cheap, and the reason why it's cheap is look at what the ingredients are. You'll have high fructose corn syrup. It'll be highly processed. You'll have a lot of oils, a lot of different oils, and you'll have things you can't even pronounce in it. And so if you're buying and it's inexpensive, check the ingredients.
And
Chances are it's not going to be good for you.
We'll be doing a video on how we're cutting back on our food budget,
Right.
and cutting back. So this is medical. Look out for our next video where Steve opens up his cards of compassion that he gets.
That's always fun. I wonder if there's any Sammi cards in there.
I wonder the same thing. We might get back one of our own cards.
Yeah, one of our own cards.
So until we see you again,
take it easy.
Our hearts beat to the city streets. we began to feel the fire. We rise like tall buildings